Let's continue with diagnosis according to 6 stages. This time we'll talk about invasion of wind cold in Taiyang aspect, where wind is dominant. Invasion of wind cold in the Taiyang aspect, where wind is dominant, there is a Wei Qi deficiency. This means that pathogenic qi does not need to be so potent to be able to invade the body, and the symptoms and signs will not be as pronounced as in the previous Tai Yang excess pattern. Because the person is Wei Qi deficient, they will often have a strong aversion to sitting in a draft and being exposed to the wind. A key symptom that can differentiate this from the previous pattern, which is invasion of wind cold in the tying aspect where cold is dominant, is that in this pattern, the person will sweat spontaneously, but the sweating will not relieve the condition. The person sweats spontaneously because the deficient Wei Qi is not able to control the pores and is not strong enough to expel the pathogenic Qi. The pulse will be weaker in this pattern and it will not be tight because the deficiency of Qi means that there is less stagnation. The mechanism behind the other symptoms and signs are the same as in the previous pattern. This pattern has its etiology in exposure to wind and cold, and it has the following symptoms and signs: acute headache, stiffness in the neck, shoulders, and upper back, aversion to cold and especially wind and drafts, spontaneous sweating but without it relieving the symptoms, sneezing and coughing, runny nose and watery eyes, facial edema or puffiness around the eyes, possible low-grade fever, aching in the muscles and joints, thin, white, and wet tongue coating, and a superficial and slow pulse. The key symptoms here are aversion to wind, spontaneous sweating, and a superficial pulse. For the treatment principle, we expel wind cold, activate the Wei Qi, and tonify the Wei Qi. So for the acupuncture points, we can choose from SI3, UB10, UB12, UB62, LI4, lung 7, lung 9, stomach 36, spleen 6, REN 12, DO 14, and GB20. We may use the tonifying needling technique on lung 9, stomach 36, spleen 6, and REN 12, and draining technique on the rest of the points. Moxa is also recommended. So to further explain the choice of points, stomach 36, spleen 6, REN 12, and lung 9 tonify post-heaven qi and thereby the Wei qi. SA3 and UB62 open the Taiyang channel, activate the Wei qi, and expel wind cold. UB10 and GB20 expel wind cold. LI4 and lung 7 and UB12 activate Wei qi, expel wind cold, and regulate lung qi. DO 14 activates the Wei qi. When a person has been invaded by wind cold in the Taiyang channels, they should avoid eating rich food and should preferably only eat soup. They will benefit from drinking hot, spicy drinks such as whiskey toddy, hot ginger tea, or an infusion of garlic, cayenne pepper, ginger, and honey. They should then wrap themselves up in blankets or quilts to induce a sweat. They should avoid exposure to drafts and they should make sure that they are suitably clothed when they are outdoors. They should preferably rest and stay indoors until they are healthy again. An invasion of wind cold in the Taiyang aspect, where wind is dominant, can be caused by qi deficiency and in turn can result to Tai Yang Fu pattern, Yang Ming stage pattern, Xiaoyang stage pattern, Taiyan stage pattern, and Xiaoyin stage pattern. Here is a comparative table on the symptoms of Taiyang cold syndrome versus Taiyang wind syndrome. In Taiyang cold syndrome, there is no sweating, while in Taiyang wind syndrome, sweating does not alleviate the symptoms. There is extreme aversion to cold in the cold syndrome, while less aversion to cold and extreme aversion to wind and drafts in Taiyang wind syndrome. There is severe headache and stiff neck in Taiyang cold syndrome, but a milder headache and stiff neck in the Taiyang wind syndrome. And there is a tight pulse in Taiyang cold syndrome, and the pulse is not tight in the Taiyang wind syndrome. Thank you for your attention.